Here we'll learn about benign breast disease. We'll learn about breast cancer separately. Start a table and denote the following. The female and male breasts are anatomically similar, though adult female breasts have more adipose tissue and a more developed ductal system. This is particularly true in those who are pregnant or lactating. The physiological role of the breast is to produce and transport milk during the hormonally regulated process of lactation. For more on hormonal regulation, see the links in our notes. To note that benign breast disease is an umbrella term for non-malignant lesions. It is more common in premenopausal women, whereas malignant lesions are more common in postmenopausal women. Patients may present with pain, masses, or nipple discharge, or there may be no symptoms and disease is found on imaging alone, which is why screening is important. Note that symptoms may be cyclical from changes in estrogen levels during the menstrual cycle. Imaging, such as mammograms and MRI, biopsy, and nipple discharge analyses are all used in diagnosis and cancer assessment. Now let's learn an overview of breast anatomy and show where different types of lesions arise. First, show an outline of the breast, which is covered in skin. Show that the majority of the breast tissue comprises adipose and connective tissues. Then show the ductal system, indicate lobular stroma surrounding lobules, which are the glands that produce milk. Show that the lobules drain to terminal ducts, which drain to the main ducts that carry milk to the nipple. At the nipple, show the lactiferous sinus, which is a dilation of the duct. Show some smooth muscle tissue around the nipple. Now indicate the following pathologies. In the lobular stroma, fibroadenomas and phylloides tumors. In the lobules and terminal ducts, fibrocystic changes and carcinomas. In the lactiferous sinus and main ducts, mastitis, intraductal papilloma, and Paget disease of the breast all can occur. In the interlobular stroma and fat, we find fat necrosis. Let's learn about these pathologies. Start with fibrocystic changes, which are the most common benign breast condition. About half of premenopausal women over the age of 30 have some degree of fibrocystic change in their breast tissue. They are non-proliferative or proliferative. Show that non-proliferative changes include simple fluid-filled cysts in the terminal ducts and papillary apocrine metaplasia with stromal fibrosis. We also show dark spots of calcifications, which often appear in fibrocystic changes. Proliferative changes, which are associated with an increased risk of breast cancer, can present with or without atypia. Show that sclerosing adenosis represents proliferative changes without atypia. We show an enlarged terminal lobule duct unit with proliferation of the glandular tissue. Proliferative changes with atypia are represented by epithelial hyperplasia, in which overgrowth of epithelial cells crowds the lumen of the duct. In general, fibrocystic changes do not require treatment, but if they're painful, the cysts can be drained. Next, two inflammatory processes, fat necrosis and mastitis. First, show fat necrosis, which occurs secondary to trauma or breast surgery. We see necrotic fat tissue, often with giant cells, multinucleated macrophages formed by the union of several cells. Fat necrosis often resolves on its own, but if painful, surgery may be indicated. Then show mastitis, which occurs due to infection, usually associated with Staph aureus or due to non-infectious milk duct blockade. It causes erythematous, swollen, painful breasts, and potentially flu-like symptoms, such as fever. Mastitis most often occurs during breastfeeding when the skin of the nipple becomes dry and cracked, allowing easy pathogen entry. We can treat infections with antibiotics. Next, let's learn about three types of benign breast tumors. First, indicate that fibroadenomas are common, particularly in women younger than 35 years old. They're usually small masses with a round or oval shape and well-defined borders. They can be soft or firm. Fibroadenomas are often larger when estrogen levels are higher, so they grow during pregnancy and shrink after menopause. Then indicate that phylloides tumors are rare and most often diagnosed in women in their 40s or 50s. These fibroepithelial tumors have a leaf-like lobulation pattern with stromal proliferation. Phylloides refers to their leaf-like appearance. These tumors can be malignant and can rapidly grow to large sizes, over 10 centimeters, which stretches the skin of the breast. Tumors can be surgically removed, and if borderline or malignant, radiation therapy may be recommended. Lastly, indicate that intraductal papilloma is a cancer precursor lesion that grows in the lactiferous ducts, often under the areola. Intraductal papilloma is a common cause of serous or bloody nipple discharge. We show that these small fibroepithelial tumors have a characteristic wart-like appearance in histological samples of affected ducts. Before we conclude, indicate that gynecomastia, enlarged breasts in males, is physiologic in prepubertal and older males, when estrogen to testosterone ratios are naturally higher. However, in post-pubertal males, gynecomastia may be a sign of cirrhosis, hypogonadism, testicular tumors. Gynecomastia can also be caused by some medications, for example, spironolactone. This concludes our diagram.